We're going to go now to Deborah Berry. She's our colleague at USA Today who's been tracking the unequal impact of the coronavirus on communities of color. Deborah, thanks
Mhm.
so much for being with us. My first question is, first, like, how is it affecting minority groups? You had a story come out this weekend, last week.
Right, right. And actually, it was a story a couple of weeks ago where we talked to a lot of experts about what kind of impact this might have on people of color. And much of them talked about, while every population is vulnerable, of course, what is particular about people of color is they're disproportionately impacted by some underlying health conditions, um, asthma, diabetes, heart disease, all those things that make them particularly vulnerable to the complications of coronavirus. So it's been a really tough situation.
Yeah, there's new data coming out right now. We saw some stories out of the South and Chicago. Can you talk about what people are hearing early impacts are?
Sure. Some of the stories, actually, we're working on a story that's going to be published later today or early tomorrow about while people have warned or have been concerned about the impact, now we're seeing where it's kind of playing out in some places. For example, Louisiana, they released some stats that showed that 70% of the people who died from corona-related virus are African Americans. And that's in a state where the population is 32% African Americans. So it shows there an example. Some of the major cities that are hardest hit by it, New York, Louisiana, Detroit, are cities that have a significant Black population. So while there were concerns about it and alarms raised about it, it's kind of showing up in some of the places that are actually releasing data, keeping in mind that a lot of places still aren't or haven't released data.
Yeah, that brings, I want to bring up our colleague Ashley. She was talking for a minute about how are we tracking the virus according to ethnic identity, and it seems to vary from community to community.
Yeah, from what I understand, there aren't a lot of states that have been releasing that. In New Jersey, they just started giving that data yesterday, and it's still pretty broad. I think we got Black, white, other, and Asian. So we don't know the Hispanic breakdown, and we only knew 50% of the cases. And these were of deaths, so we don't even know the cases at this point. So it looks like we're just kind of starting to get a snippet of that, at least where I cover the coronavirus news. So it'll be interesting to see if more states start disclosing that data.
Deborah,
And
you were
actually,
saying, oh, sorry, go ahead. I was just going to toss to you. Go ahead.
I was going to follow up with that is that there is a call now, and there's been a call before. Representative Robin Kelly of Illinois, for example, she's chairwoman of the Brain Trust for the Congressional Black Caucus. She and others, some members of Congress, have written letters to CDC and the HHS secretary, and even more recently, as of today, the NAACP and other groups have also raised alarm, calling for all these groups, for the federal health officials to release data, but they're also calling for states individually to do it because they're talking about how important it is to have that data so they know how to respond. So health officials, state officials know how to respond and where to direct resources.
And it just sounds like that's happening at a really slow pace, if it's happening at all.
Right, right.
I want to ask you, Deborah, your story talked also about how minority workers are being impacted by this in particular. Can you speak to that?
Sure. And many of the service industry jobs, they're disproportionately filled by people of color. And that includes some of the people who are going to work now. That would be the bus drivers, the people in transportation, the home health care folks. So those folks are vulnerable. Well, one, they're people of color in those health conditions, but they're also vulnerable because they're exposed or could be exposed. They are exposed, and sometimes they're exposing their families. So there's a lot of ways where people, community are impacted both economically, both by the health disparities that already exist in our country. And so that's why a lot of these groups, civil rights groups, advocates, community groups, are raising alarm to please pay attention to these communities who are already marginalized in many ways and who are particularly vulnerable.
It sounds incredibly scary. So I'm going to ask one question that might have some good news to it, but I want to say, like, what's being done to support at-risk communities?
Well, one of those things is one of those things these groups calling for all this attention or trying to bring attention to the needs of this community, calling for the racial data. Some groups have long before the coronavirus have been stepping up to try to address disparities, especially healthcare disparities, particularly faith leaders, churches. I did a story maybe a year ago about all these religious leaders having this big conference in a church to talk about how they can do things in their church, whether it be stop serving fried chicken on Sundays, whether it be to turn the parking lot into a track so that folks could walk around. So groups have been stepping up along the way to do this anyway. But I think now the sense of urgency is obviously right in your face, because the virus is affecting every community, and particularly the poor and the minority communities.